Welcome back to another episode of RPEC On Air, a podcast produced by the Retired Public Employees Council of Washington. I'm your host, Alyssa Brady, and I have two lovely co-hosts on for part 2 of our 3-part special about Medicare Open Enrollment. And this episode will be covering Medicare Open Enrollment for those in the commercial market. Joining us again as my co-hosts, I will call you, is Matt Groshong, Chapter 3 President and Healthcare Workgroup Chair, and Tim Smolen, SHIBA Program Manager. Hello, and welcome back, both of you.
So, Alyssa, Matt Groshong here. I work for 2 community colleges, and I'm the chair of the RPEC Healthcare Workgroup, and I'm president of the Chapter 3 in the Seattle area. And like Alyssa said, I welcome you to our second podcast this year on retiree healthcare. And today's session is very important for RPEC retirees who buy their health insurance directly from a health insurance company or through a broker. That is, they don't get their coverage through PEB. Our next podcast will be for retirees who do get their health insurance from PEB. So now I'm very pleased to introduce our expert presenter today, Tim Smolen.
Hello, Matt. Hello, Alyssa.
Hi, Tim. Tim is the SHIBA Program Manager in the Consumer Protection Division of the Office of Insurance Commissioner in Olympia. That's a mouthful. And the SHIBA program offers highly trained volunteers who offer one-on-one impartial advice on health insurance options for retirees like us. And Tim has wide experience working in various Washington state agencies, including the Healthcare Authority and also a private insurance company. On top of that, he's a great friend and supporter of RPEC. Tim, thanks so much for your time and expertise, and I hand it over to you.
Well, Matt, it's a pleasure to be with you again. I really have enjoyed our conversations last year and into this year, and it was a pleasure to meet you at the RPEC convention this year in Wenatchee a few weeks back, and your lovely wife, Kathleen. And Alyssa, it's great to see you again, and thank you for bringing some professionalism to the show that Matt and I did amateurly last year.
It was wonderful. It was wonderful. Got lots of good feedback. That was very helpful to a lot of people. So thank you all for doing it again and doing it in a different style this time around. Why don't you tell us a little bit, about those stinky commercial market
Right.
Get us into it.
Yeah. Well, I think in the first program, as Matt said, we kind of conceived this as 3 programs for this year. And in the first program, we really talked about people getting ready to get started with Medicare, which for a lot of people can feel really fraught and like a very high stakes conversation and not without good reason, obviously. And so in this program, we're going to talk about kind of folks who are already enrolled into the Medicare program, and now they find themselves at what we call the Medicare Annual Open Enrollment Period, which is October 15 to December 7. As Matt said, I'm representing the perspective of the insurance commissioner and the SHIBA program. Most of the work of the program is done by volunteer advisors who are trained by the professional staff here in our team. And we do about half of all the work that we do in the whole year happens in the fourth quarter during this Medicare open enrollment period. So we just have this surge of work, which is honestly a lot about all the advertisements that people are getting in the mail and on the phone and text and all the ways that the companies can think of to market their product to you. And so in some ways we're in a bit of a reactive posture, right? Because this can feel overwhelming and confusing to people. And so they seek us out because, as Matt said, we're unbiased. We're not selling a product. We're not preferring one product compared to another. We're not trying to kind of put our thumb on the scale here in terms of affecting your judgment. We just want you to feel good about the choices that you make. But it does feel like a bit of a high stakes conversation. And, when Matt and I conceived these programs, we didn't know yet what was going to be true for 2025. But now as we're sitting on the first week of October, we know that for a lot of people, they'll be losing access to their current insurance, which is, very, very unfortunate and upsetting to people. I don't, as we're recording this today, I don't have a good number for you, but round numbers wise, this is going to be, 60 to 80,000 people in Washington state. And it's going to be some, big name plans like Regents and Premera and Aetna that have taken a business decision to not continue to offer the plan that you have today. So this open enrollment in particular is going to feel, even more a little bit frantic for people. So really appreciate you both taking some time to talk about it so we can, provide some support for people.
Yeah, thank you. The stakes are high, and the more I learn about it, the more I actually get afraid I get in a way. But it's good to get me prepared. I know I have time, but but it's still scary. It's scary to know that it is confusing and complicated and hard to navigate. So I'm glad we have programs like SHIBA. But yeah, the stakes are just so high, and it's like you could go a year without having anything covered if you don't do this right and follow the timeline as you're supposed to.
Yeah. So as I think you and Matt did a nice job of kind of framing up this conversation. So this program really is for people who are not in an employer group plan like the HCA PEB program, nor are they enrolled in a state-sponsored program through the Medicaid program. And this is most of the people in Medicare are in these commercial market plans. And part of the challenge, of course, is that for about the past, since the mid 1990s, really, now we have two systems of Medicare benefits, which are what we would call original Medicare or Medicare Advantage plans. And most of the churn, so to speak, is happening among these Medicare Advantage plans as that market becomes more mature and the economy around physician practices and hospital practices and the kind of the technology that supports the insurance industry, as that continues to develop, that's where most of the kind of excitement, if I could use that word, about Medicare enrollment is happening. So with that, let me just kind of hop right into some kind of practical aspects then, and you'll both have questions or contributions as we go along. So what's happening during this open enrollment period is it is your once a year chance to make a change to your insurance. And I'm going to describe that kind of as being in two kinds of ways. So for folks who are in original Medicare, then you probably have what we would call a standalone Medicare Part D plan. That's how you're getting your prescription drug coverage. And so you'll be looking at, gosh, is this still the best plan for me next year? And what I'm going to suggest is it's really worth taking some time to investigate whether it really is the best plan for you again next year. So 3 things that I would highlight for you. The first thing is that every year the plans make changes to their own plans. Those are kind of customizing the formulary, which is the list of covered drugs. They're negotiating with the networks of pharmacies and mail order, and they're making decisions about things like prior authorization, step therapy, generic substitution, all of the kind of benefit design questions. How much will you pay for a tier 1 drug compared to a tier 2 or tier 3 drug? And so it's probably, I would say, always advisable to just do that work of what's different about my plan for next year. This year in particular, though, we're at the place where there's going to be a pretty significant change that Medicare has initiated, which is that this is the last part of the Inflation Reduction Act changes. So we're going to see a change in the plan design, no more donut hole, if you're familiar with that concept. And all of the plans, by kind of mandate of Medicare, will have a maximum $2,000 out-of-pocket limit. So the plans will be making changes, and Medicare is also imposing, these changes by rule in terms of plan design that are meant to make these plans more affordable to you. And then the third thing, of course, is that your needs change. it across the year, you might find that you're using more or less or different kinds of drugs, or anticipating next year needing different kind of drug therapy. So independently of what the plan is doing and what Medicare is doing, you just might have reconsidered that there's a better plan option out there for you because your own needs have changed.
Tim, I've gone to Medicare.gov and looked at the different Part D plans. And correct me if I'm wrong, but if you're taking a tier 2, 3, 4 drug, you might be able to save tons of money by switching to a different Part D plan. So this is a real pocketbook issue that I think many people overlook. They just sign up for a Part D plan and that's what they stick with because that's their Part D plan. And my guess is that the insurance companies probably know they can take advantage of that.
Yeah, no, I think that's a very good point, Matt. This is, I would describe it the same way. It's a pocketbook issue, and there literally is thousands of dollars at stake here. Lots of seniors are still paying $3, $4, $5, $6,000 a year for their drugs, and there's an opportunity to save a lot of that money by investing and doing some research. And as you said, the Medicare.gov website is the best way to do that. They have a terrific tool that they call the Medicare Plan Finder tool. It's pretty intuitive and simple to use. What you're going to need is a list of the drugs that you're currently taking, including the dosage, the strength, the frequency, and then you'll load those drugs into the kind of online portal, right? And then it will produce for you a list of the plans that are likely to be the best fit for you, the lowest monthly premium, the lowest out-of-pocket costs. So for a person who has, reasonable broadband internet access and some facility for using the computer, you could probably complete that review front to back in 30 minutes. If you're a person without access, or if you just don't feel super comfortable, a SHIBA volunteer would be happy to help you with that. Certainly, the libraries all have high-speed internet access and great professional staff that you can print for free, you can scan for free from the library. So that shouldn't be a barrier, but it is the best tool, and it really is a well-designed tool for sure. Thanks for that. So staying for folks who are in the original Medicare side of the world, then you likely also have a Medicare supplement plan. And these are also called Medicare Med-Sup plans or Medigap plans. And so these are the plans that pay the part of the bill for Medicare covered services that Medicare doesn't pay for. So what I mean, for instance, is Medicare will pay 80% of a doctor's bill, your plan will pay the other 20%. So you'll also hear these referred to as like the lettered plan. So I have Medicare Supplement Plan G, or I have Medicare Supplement Plan N. And so those are the plans that we're talking about.
Oh, geez. Okay. Yeah, I was going through this and I'm looking at okay, there's all these different parts and they also have letters. They're also the alphabet. And then there's the plans and they're also going through the alphabet, but they're not the same thing. It's different.
It is. It's
Not
so
confusing though at all.
No, and it's honestly, it's worse than that because in the beginning of time, they were lettered and followed the alphabet. So A, B, C, D. But then over time, over the course of a couple of years, we decided, well, we weren't going to offer some of those lettered plans. So we just extended the alphabet. So first we had H, I, and J, and then those went away. So then we had K, L, M, N. So, and now they're not continuous, right? Because a plan C or a plan F, you can only buy today if you were eligible for Medicare back in 2020. So if you were literally to go to the Medicare.gov website, again, which I'm going to recommend to you, and say, I want to see the plans that are available to me, they're lettered plans, but they're not contiguous. So you're going to say, what happened to C? It's like Sesame Street. What happened to the letter C?
Hey, Tim, in terms of a pocketbook issue as well, regarding choosing a Medigap or supplement plan, is it true, one, that they all have to treat you the same? They have to follow rules by Medicare. And so there's going to be no difference in how they treat your claim. and then the other thing is they charge different prices.
Yes.
And what should you do if you find that your plan is costing $250 a month and you see another one that costs 190? What do you do?
Yeah, Matt, that is such a good question. I'm always struggling for the right like metaphor or analogy to explain this. And I haven't settled on one, but I think for today that I would say is like if I was to go out to get a hot dog at Costco, I'm gonna pay $1.99 because they insist on only charging $1.99 for a Costco hot dog. But I know that Safeway sells exactly that same hot dog, but they're charging more than $1.99. But it's the same exact hot dog. But perish the thought that I go to Safeco Field and buy exactly the same hot dog.
Yeah.
It costs 10 times as much, but it literally is the same hot dog, right? So it's the prices that the companies are getting are not at all about the product. You're exactly right. The fact that they're lettered plans means that they're standard plans. And so the difference in the rates is not about the product, it's about just the marketplace. So I think if I was to take your question literally, and I found myself with one plan that cost $250 and one plan that cost $190, I'd say I'm going to save $60 and switch.
And isn't there a wonderful chart put out by the Office of Insurance Commissioner that lists all the Medicare supplement plans offered in the state, their cost, and also they have a wonderful column that talks about whether, well, I won't go into that. That's later. Anyway, there's that wonderful column sitting there. So you don't necessarily have to go to Medicare.gov and go one by one through the different plans. There's a nice chart sitting there. The work's all done for you, and you can find plans that cost a lot less maybe than the one you have and save yourself some bucks.
Yeah, thank you. I appreciate that, Matt. We like that chart. So we do, these are plans that are regulated by the Office of Insurance Commissioner. So we approve the rates for the companies, right? They have to justify the rates that they file with us based on their claims experience. And we do produce on a quarterly basis a list of companies that are approved to sell products in Washington and the per person per month rate that they get for each of the plans that they're offering. So it's pretty simple to just compare the cost of a Plan G with Alyssa Company compared to the cost of a Plan G with Matt Company, and then make up your mind whether you want to switch from one to another. As you said at the outset of the program, this is a place where an agent or broker might be helpful to you. You can call the company and ask, is there a local agent that I could get some help with, for instance, to fill out the application paperwork? But there are also things that are very easy self-service. All the companies have phone numbers and websites, and you can pretty simply engage that. Or again, a SHIBA volunteer would be happy to talk with you and kind of help you see the differences between a Plan G compared to a Plan N, or an ordinary Plan G compared to a high deductible Plan G. This is kind of grist for the mill, if you will, for SHIBA volunteers.
And whatever you do, get it done by December 7th, right?
Yes, right. Thank you for that. So very, very important. This Medicare open enrollment period is a defined period of time. So you have October 15 to December 7 to get your business done here. So if you're thinking about switching your Medicare Part D plan, please get that all done by midnight on December 7. So then with that, let's pivot to folks who are on kind of the other side of the Medicare equation. So now we're talking about folks who are in the Medicare Advantage system of care. And we're going to make a distinction here between folks who are voluntarily leaving compared to folks who are kind of compelled to leave because their plan is not going to be available to them next year. So the most likely case is for these people that they're going to switch to another different Medicare Advantage prescription drug plan. So if you got a note from Premera saying we're not going to be offering this Medicare Advantage plan anymore, you're going to be upset, you're going to be frustrated, but then you're going to say, okay, I'm Matt, I live in West Seattle, King County. show me the other Medicare Advantage plans that are available to me then in King County so that I can choose one of those instead. And that's the most likely outcome that we're going to see, whether it's voluntary or involuntary. If you're in a Medicare Advantage plan, you're likely looking for another one to replace the one that you have today. I would say the couple of dimensions that are the most important here then is make sure you can keep your doctor, and then do that exercise that we just talked about a moment ago about check for prescription drugs, because all of the Medicare Advantage prescription drug plans have their own network of doctors and hospitals, and they have their own pharmacy network and their own formulary of drugs. So again, we're going to come right back to the Medicare website, the Medicare Plan Finder tool. If you have access, it's pretty straightforward. You can actually change plans right from there. And the good news about these plans is that because they are under contract with Medicare, you don't have to cancel your existing coverage. Enrolling in the new one satisfies canceling the old one. For most people, they have their premium taken out of their Social Security check, so you also don't have anything to do about that. If you are a person who's doing direct pay or having like an automatic funds transfer, it's probably advisable just to check in with your bank so that they understand that you changed and they don't do something like treat it like a fraudulent charge or something like that. Or you should just be aware that the premium might wiggle a little bit from one plan to another. But the critical thing for you to do is to check in with your doctor and make sure which plans they're currently taking. So before you sign up for a Humana Medicare Advantage plan, call your doctor's office and say, hey, look, I'm on the Medicare website and there's a Humana Medicare Advantage plan. You can read them the plan number from there and say, I just want to confirm that if I choose this plan, I can continue to be enrolled in your practice. That would be the caution on the provider side.
Tim, I'm gonna wade into something quickly that I was looking at the different Medicare Advantage plans that are offered in King County because I live in West Seattle, and there are all sorts of plans available from a $0 monthly amount all the way up to $380 a month. And I think it's really important for folks looking at Medicare Advantage plans to understand that maybe the most important column is the total out-of-pocket cost before they start paying for everything. Usually they'll pay, you'll pay next to nothing for your regular doctor. But if you go to the hospital or something like that, there are many plans there was one I saw that said you'd have to pay up to $14,000 before they'd start paying. Lots of them, it's around $5,900. And so it's really important, just like we were saying, and looking for Medigap plans, it's really important to really look at that out-of-pocket cost, because Medicare Advantage plans, in my opinion, they're great. If you don't get really sick. If you get really sick and you go to the hospital, you're going to be paying a lot more money out of pocket than you would with original Medicare.
Yeah, I think that's a really succinct summary, Matt, of kind of the pros, cons, or the merits of one compared to another. It's not necessarily super tidy, but I think you could say what people like about the Medicare supplement plans is after you pay your monthly premium, everything is taken care of by Medicare. It's essentially a no surprises sort of plan. So you're trading off a higher monthly premium for the certainty that whatever you need, it's taken care of. And essentially, it's an unlimited network of providers. Any doctor that contracts with Medicare, your Medicare supplement plan is good for them. On the other side, in a Medicare Advantage system, you're going to likely have a zero or a very low monthly premium. However, you're going to have deductibles, coinsurances, copays every time at the point of service. And so it can be very difficult to forecast, but you know that you could accumulate a lot of bills, $20 or $50 or $100 at a time over the course of the year. And the same thing could happen with your prescription drugs. And all of these Medicare Advantage plans, by definition, are managed care plans. So you're going to have a network of providers. And if you see a provider outside the network, or you see a provider without a referral or an authorization, you'll have a financial penalty for that. So you're more constrained in terms of choosing your own provider or managing your own referrals. So I think we could say at bottom, that is a kind of a tidy way of describing the trade-off. The other thing to highlight just is that it is true that for a lot of people, part of the attraction of the Medicare Advantage plans is they do pay for extra benefits that are not part of the original Medicare program. So obviously we're talking about vision, hearing, dental. For some people, it can be gym membership or transportation or food card or help with utilities. And so, right, so those are things that the Medicare Advantage plans offer as an extra benefit that are not part of your Medicare coverage. And for some people, those are very persuasive.
And I'd add another advantage for Medigap plans, original Medicare, would be that there are very few prior authorizations. Prior authorizations mean, correct, that your doctor has to fill out something and send it to the insurance company to get a treatment that the doctor thinks you need, and the insurance company on the Medicare Advantage side can say no. And on the original Medicare Medigap side, they generally say it's just a computer program and it's just sent through. So for me, both of them have, both kinds of Medicare insurance have their positives and their negatives. My concern is there's so much advertising on the Medicare Advantage side that they want you to buy them. And original Medicare has very little advertising, but it definitely has its advantages, just like Medicare Advantage has its advantages. So it's best to contact like SHIBA for them to help you figure out what's best for you, depending on your needs, your budget, your health, your drugs.
Yeah, no, we appreciate that, Matt, and that is, I guess, the service that we can provide is, we as I say, we're unbiased, we're confidential, we're neutral, so we're not going to steer you away from or towards a Medicare Advantage plan compared to a Medicare supplement or vice versa. We're just going to try to help you land in the best place for you. Yeah, so thanks again for the commendation. So let me come back to our friends who are in the Medicare Advantage business coming into the open enrollment period. Some of them won't really be facing a choice this year because they've been told their plan is leaving for next year. So let's talk about just for a second what's different for them. So for the folks who want to switch from one Medicare Advantage plan to another, again, that's pretty straightforward and it doesn't really depart from what the map of the world looks like for voluntary switching. However, for the folks who want to exit a Medicare Advantage plan and move over to original Medicare, the folks who are losing their plan have extra rights that the people who would be moving voluntarily don't have. And so the technical expression for this is guaranteed issue rights. And what we mean is that the Medicare supplement plans, because they are sold by private insurance companies, are allowed to apply what we call medical underwriting. So you're going to be asked to fill out a questionnaire about your health status, and depending upon how the company views you as a risk to them, you could be declined for insurance. So that's a standard feature of these Medicare supplement plans. It's part of how they manage, the pool of people that they're responsible for and keep the rates, kind of in line. So for our folks who want to move from a Medicare Advantage plan to a Medicare supplement plan on a voluntary basis, you would be subject to medical underwriting. So it would be very important not to cancel your MA plan coverage until you have a Medicare supplement plan in force for January. So we would want you to choose one of the lettered plans. choose the company that you want to buy it from, send your application, get your acceptance letter, and then cancel your MA plan for 2025. But don't cancel without that acceptance letter. On the other side of that, for our friends who are losing their plan, you do have guaranteed issue rights. So the company cannot deny you coverage. So the path for you is going to be like, choose your lettered plan, choose the company, send your application, but you will be accepted. So on your form, just provide, I would like to start January 1st, and then you may be asked to provide a proof of loss of coverage. So you will have received a notice from your current MA plan that they're exiting the market.
Okay.
And that's kind of your pass on medical underwriting, passing the health screen, right? So anyone is allowed to move from an MA plan to a Medicare supplement plan, but only people whose coverage are terminated have a guaranteed issue right. Other people would be subject to medical underwriting.
So does that mean that when you choose your supplement plan, you want to make sure you choose the right one when you first enroll into Medicare? Because if you can't really enroll, well, you can switch voluntarily, but you might not be able to get into those. So you basically, when you retire, whenever you're eligible for Medicare, I should say, you have to make sure you choose the right plan then, and then it's kind of like, all right, hope I did the right thing. 25 years from now.
Yeah,
Good
no,
question.
you're not wrong. And again, reflecting back to the program that the three of us did about getting started in Medicare, that's part of why it feels kind of fraught to people, right? Because when you're just starting out in Medicare, you have the option of either original Medicare or a Medicare Advantage plan. And there is this kind of magical time that we call the Medicare Supplement or Medigap Open Enrollment period. And so this is like a once in a lifetime 6-month period when you turn age 65 and elect Medicare Part B that you also have guaranteed issue rights. So there is this dramatic tension that people feel like, well, what if I go to a Medicare Advantage plan and I stay there for a few years and then decide I don't like it? Well, you're right. You're not guaranteed to go back, right? So some people, just out of a abundance of caution, are going to choose a Medicare supplement plan in the beginning for fear that they may not get it later. So your instinct is exactly right.
Fair enough. Yeah.
Yeah, good question. And I will say that the wonderful chart of the Medigap plans in the state from the Office of Insurance Commissioner, at least for 2024 plans, I don't know for 2025, there was one plan offered in the state, that Medigap plan, that did not require a medical screening. So if you call up your friendly local SHIBA volunteer or a broker, I suppose, there might be a plan, a Medigap plan that does not require a health screening. And I don't know if that's true or not for 2025.
Matt, that is a great question. Let me just take one step back for a second, if you'll give me some license here. So I want to make a distinction between people who are eligible for Medicare because they're age 65 compared to people who are eligible for Medicare because they're disabled. Because the rules about Medicare supplement plans are different for under 65 compared to over 65 people. So that Medicare supplement or Medigap open enrollment period that I described, it really literally is a feature that it's the 6 months when you're 65 and have Part B. So if you're a younger disabled person, you have no such guaranteed issue rights until you turn age 65. And so the same, Matt, applies to the question that you asked then about, there is a group Medicare supplement plan. The group is managed by the HCA PEB. So this is literally the same pool of people who include people who are retirees in the HCA PEB portfolio, as well as a small number of people who are not inside that pool. We've kind of grouped them together, And the eligibility for that plan that you referred to, where there is no medical underwriting, we refer to as the state resident plan. So as a new state resident, you have access to that insurance that is actually part of the PEB pool for purposes of making the rate. And it is represented by Premera, and you can talk to an agent who represents Premera about getting enrolled in that plan. But yes, all of the plans in the Medicare supplement plans require medical underwriting, and those rules apply to people who are over age 65, because everyone under age 65 is limited, both in that they have to pass medical underwriting and that there are fewer plans that are available for under age 65 Medicare beneficiaries. So our state does not require that all the companies offer all the plans to under age 65 people.
Right.
All right.
So
Figuring
yes,
this
Elizabeth,
out bit by bit.
that's a very insightful question that a lot of people are going to kind of enter into Medicare thinking, I have original Medicare or I have Medicare Advantage, but knowing that, presumably because they already have a pre-existing healthcare condition, and I'll just say a person who has multiple sclerosis, for instance, that's a thing that's almost certainly going to get you declined for a Medicare supplement plan, even as an over age 65 person. So you're going to be pretty clear-eyed thinking that if I enroll into a Medicare Advantage plan now, and then a few years later I try to switch, it's unlikely that I'll be accepted into a Medicare supplement plan. So if I feel like that's the right kind of insurance for me, I almost certainly need to do it immediately when I am making that first getting started in Medicare choice.
And unfortunately, the Medicare Advantage ads that bombard us are not helping make a rational decision regarding that for many people.
Yeah, no, it's I mean, I think that it's probably if it's not the number one concern, Matt, it's in the top 2 or 3 about the aggravation people experience over postal mail, email, text, other kinds of outreach and education. I'm sure it's well intentioned, but it just feels overwhelming to people, and unfortunately, it can contribute to that unsettled feeling. And most unfortunately is when it is sort of stuns people into inaction, right? In the face of too much information, they don't do anything. And that's a bad outcome, right? So I don't mean for this to turn into like the Halloween doom and gloom kind of presentation.
It's
but
spooky season,
it's
so
spooky season. So for those people who are,
scary.
so for those people who are losing their coverage, right? If you got a notice that your Medicare Advantage plan is not available to you anymore, you have to know that Medicare is not going to kind of swoop in and take care of you. So they're not going to, for instance, assign you to another Medicare Advantage plan. They're not going to choose a Medicare supplement plan for you. If you do not take action October 15 to December 7, you will end up on January 1 with Medicare Part A and Medicare Part B, but you will not have any prescription drug coverage, and you will not have any protection against the deductibles, coinsurances, cost sharing in original Medicare. So you have to take action, or that's a bad outcome.
That is bad.
Right? Or if you don't take action, you have to know that they're not going to, like, there's no paternalism in this, right? There's no kind of safety net. And unfortunately, this is kind of a time-limited proposition, right? So if you don't take action by December 7 for January 1, then your next opportunity is essentially 12 months later when it's the next open enrollment season. So now effectively you've gone 12 months without a prescription drug coverage or financial protection. And then when you try to hop in later, now you're going to be penalized for being late for Medicare Part D. So as much as it feels kind of icky, and it can feel kind of overwhelming, if you're one of those, and I'm estimating here, Matt, but 50 to 80,000 people who got the letter saying your plan is being discontinued, you simply have to take action. You got to kind of summon up your courage and seek out some support, because we don't want you to be in that place where you're your insurance is so much skinnier than what you had today. So again, the SHIBA program, 1-800-Medicare, an agent or a broker, talk to a good friend like a RPEC chapter president, someone on the healthcare committee, but don't just feel so overwhelmed that you kind of put it off, because this is a time-limited choice that you have to make.
Very well said. Thank you, Tim.
Yeah, I think there's something called information fatigue, I want to say. It's something like that. But yeah, people literally, they do get kind of exhausted when they're flooded with all these emails or whatever, and then yeah, they just don't do anything. It happens to us
Right.
all. I shouldn't say they. I mean, we,
does.
us as
No,
humans.
it does. It does. And I think that, again, not trying for this to be, a haunted house scary kind of thing, but it's not like when you got super busy in the spring and you missed the April 15 filing deadline, and now the IRS is going to penalize you $100 for being late. It's not like that. It's more severe. Missing this deadline, if you're a person who got a notice that you're losing coverage, has real severe consequences. It would be hard to say that you could afford to find for a whole year the 20% of every doctor's bill that you're going to have, or the full cost of every prescription that you're going to have. That's an exceptional rare person for whom that would not be a big impact. So please don't let that happen to you. Please seek out some support, as challenging as it is.
The December 7th deadline is truly the day of infamy if you miss it.
Right.
Yeah.
For our friends who didn't study history, Matt's referring to the
That's-
famous Franklin Roosevelt
Yeah.
quote about December 7 being a day that will live in infamy.
Correct.
It's true. And this is why. This is
Don't let
exactly
it
what he was
happen to
talking
you.
about.
So, Alyssa, do you feel like you're ready for me to do kind of a summation here?
Well, do you feel like you've said everything you need to say and that we're ready for a summary? Because if so, then yes.
I think so. I mean, I think the way to understand this whole program that the three of us are doing today is just that we want you just to know that there is support out there. You're not all alone in the world, and that there are really good options out there for you. And there's great technology supporting those options. If you're not a technology person, either because of, the pipe doesn't come to your house, or you have other issues with using the technology, there's support for that as well. So we don't maybe want to problem solve all of the details today, as much as just to remind people that this is the time and space to make a change, either on a voluntary basis or an involuntary basis, and that, we're holding ourselves out for some support. But, we can go into all the nitty-gritty details another time.
It sounds like inaction is not really something anyone should do right now. They shouldn't assume that something's just going to auto enroll. It seems like, in a way, no one is safe. Like, every single person needs to be checking to make sure that
Every year.
Yeah, we would legitimately say that. I think that, Matt, I think Matt's right. It's like an every year kind of thing. But, this year in particular, because Medicare has changed the plan design, which is all to the good, you're going to have lower out-of-pocket expenses. But it means that, the current plan might not be the best plan. It's not time for cruise control or, crockpot, set it on low. It really is time. Although it's a good idea every year, it maybe is a bit more urgent this year. And then this is a somewhat unprecedented wave of plans discontinuing in Washington State. We really have not seen this kind of switching, right, where plans are exiting the market. Again, round number estimate, 60 to 80,000 people, which is, a substantial number of people. So by way of review, then, what I would say is, if you're currently enrolled in the original Medicare system of care, take a look at your Medicare Part D plan and make sure it's still the right one for you. We refer to these as the standalone Medicare prescription drug plans. And as Matt said, the Medicare website and the Medicare Plan Finder tool, you're going to put in the list of drugs that you're taking, the pharmacies that you prefer, and you'll get a review of what look like kind of all in best cost, best access plans for you. You can enroll directly from the Medicare website, or you can call 1-800-Medicare, or you can call the plan directly. or you can call a SHIBA volunteer. Enrolling in one automatically disenrolls you from the other, so it's pretty straightforward administratively. If you have a Medicare supplement plan and a Medicare Part D plan, it might be a good opportunity to check and make sure you still have the best Medicare supplement plan for you. And so we talked about that these are standardized plans. We refer to them as the lettered plans. Matt and I recommend the OIC has a listing of the companies that are currently approved for sale, the plans they offer, the rates for those plans. It might just be a good time to check and see that you're getting the best possible coverage, because the products are not differentiated. It's the identical product regardless of the company that's selling it. And so again, you may have just been watching your premiums creep up a little bit every year, not aware that there might be other options in the market for exactly the same insurance.
Remember the Costco hot dog analogy,
Remember
folks.
Yeah, the Costco hot dog, the half gallon of milk from Wilcox Dairy, the 5 gallons of gas from Chevron. It's hard to explain why Matt, my wife and I have a cabin in the woods, and so we have propane, right? So I can cook on the grill outside. And it's remarkable how much the cost of propane moves from one place to another place to another place, when I know the same propane guy is delivering to all of them. And so I just like, how can it be $3.29 in this place and a mile later it's $4.29 when I know the same guy delivered to both dealerships, right? And it burns the same. So yeah, whatever metaphor or analogy you like, it's the identical insurance product. For our friends who are in the Medicare Advantage side of the world, and it's about 50-50 right now in Washington State, we have about 1.5 million Medicare beneficiaries, and they're about 50% in original Medicare and 50% in Medicare Advantage plans. The Medicare open enrollment period is your opportunity to switch from one MA plan to another one, or to switch from an MA plan back to or over to a Medicare supplement and a Medicare Part D plan. And the distinction that we talked about here is whether that's a voluntary or an involuntary change. If it's a voluntary change, you want to make sure that the Medicare supplement plan will enroll you. So choose a plan, choose a company, submit the application, get your letter of acceptance before you cancel, and get that all done before December 7, please. If it's an involuntary transfer, if you got a letter telling you your plan is being discontinued, then you have a special protection that we refer to as guaranteed issue rights. So the steps are essentially the same. Choose your lettered plan, choose your company, complete the application, but you cannot be turned down for coverage. And then go ahead and provide a proof that your current coverage in the Medicare Advantage plan market is ending, and you'll be enrolled for a start date of January 1. So I know it's an awful lot of technical material. I have confidence that people can do this. I have confidence that support is out there for you, but I'm not meaning to discount how this is going to feel sort of overwhelming. So please don't get worn down by what Alyssa called information fatigue, and go find some help. And I hope this podcast is useful to you as you navigate through this open enrollment season. And Matt and Alyssa, thank you again for inviting us to be part of RPEC On Air.
Thank you, Tim. Great job.
Hang on. Thank you, Tim. I had to wait for this really motorcycle just kind of like, hey, you can still hear them. Well, well, thank you, Matt, and thank you, Tim. So next time
is going to be for people who get their insurance from the PEB plans, talking about the 2025 offerings, comparing and contrasting, and that'll be it.
That's it, and that's all. Yeah. So stay tuned for that, although we're releasing them all at the same time, so just listen to that one right after this one if you like. So yeah, thanks everyone for tuning in to RPEC On Air, and we'll talk to you next time.
Hey Tim, on another thing, I'm almost halfway through Medicare and You, highlighting, underlining, and
Okay.
I'll have some questions for you at some point, but not a ton.
I'm excited. Thank you.
Where do you get this book from that I'm hearing about?
You get it online.
Okay.
Yeah.
I get it online because I don't get it because I'm not on Medicare. I have to.
Correct.
Okay.